To understand it, you have to start with the definition of what humanitarian intervention is. And humanitarian interventions are to save lives, to alleviate human suffering, and if you can, to preserve human dignity. So the humanitarian information should go for those goals, should help various actors and the people involved arrive at those goals. In the context of an epidemic, for example, it's important that people know how to avoid getting sick and how the sickness is transmitted. So therefore, it's a humanitarian information for those people to understand that and then to make their own decisions about how to avoid getting sick. And in, for example, a war zone, it would be, where is the danger? Where is the front line right now? Where are the battles taking place? To know whether or not you have to take that difficult decision to abandon your house, to flee, and where to go to seek refuge. Timely humanitarian information can absolutely save lives in a war context and also in a natural disaster or other rapid onset circumstances. For example, in Bangladesh, when we started working in the camps of the Rohingya, we realized that a majority of the population didn't even know that to get clean water, they needed to boil it. And so we were able to produce information and distribute information on that topic. And knowing that in the conditions in which they were living, which is in mud, which is during the monsoon season, which was initially a spontaneous camp that didn't have a lot of the nicer amenities you can find in well-prepared and planned camps. Knowing all that, this information was absolutely key for these people to be able to avoid sickness. For humanitarian actors, having the right information, the timely information, and and accurate information is absolutely key to be able to do your work properly. So be able to arrive to achieve those goals of saving human lives, you need to know, for example, what the real situation is on the ground. For example, usually you need to go to local authorities or local sources of information to know. You need to find the information from local authorities, local health authorities, clinics. Sometimes the best option when none of those exist or when they've been destroyed, what have you, or have fled or have never ever been present in some of the most remote areas. Sometimes the best options is to speak, obviously, directly with the affected people. So being able to go out into the community, asking the right questions is absolutely key, and making sure that you can see what tendencies are going on. What do people say are the big needs? Is the water polluted? Do people have access to water? How many homes have been destroyed? Is the area safe? Are there armed groups? Are there bandits? Is there a risk for fighting to break out or to overtake the village or the city or wherever you're at? This is all information that's absolutely key, and you have to double check. You have to check with various people and cross your information to make sure that you understand what's really happening in the area. Rumors in a situation of crisis can be catastrophic. I haven't reached myself, I haven't had a circumstance in which I had to confront a really catastrophic rumor, a consequence of a catastrophic rumor, but I've been alongside agencies that have. I remember, for example, in Haiti, after the earthquake and then the cholera epidemic, so in 2010, 2011, there were rumors that it was, of course, the international organizations themselves that were spreading cholera.
C'est ministère qui vient choléra dans le pays, c'est le ministère qui aller pour nous vivre. Parce que si goudou passe, nous pas mourir, et pas ministère qui vient pour venir tuer nous dans le pays avec choléra.
And so therefore, the people who were taking care of the cholera patients were deemed the enemy. they were attacked. And we see a similar situation going on right now in the east of the Democratic Republic of Congo, in the Butembo area, North Kivu, where for the same reasons, or very similar reasons, local populations and militia groups, because this is also a war zone, are attacking these treatment centers for Ebola, because they fear that government powers that are hostile to them, or international organizations, or foreign governments want to exterminate them. So that in that case, humanitarian actors become a target of violence. For humanitarian actors to know that there is also a source of information from a journalistic standpoint, so media on which you can rely for accurate information, it makes a big difference, because then you actually, you know that that news source actually sent someone to the zone where there's a problem. That person actually interviewed people who are involved with the problem and know something about it. And the information has been checked, verified with another source, so then you can actually make decisions based on some of the information that's coming to you. So information in a war zone is extremely touchy. Humanitarian actors are absolutely a source for war correspondents, journalists, to find out what's going on. But for both, I think, the correspondent and for the humanitarian actor, it puts them in a slightly difficult situation. If certain information that is given could be deemed as useful to one party or the other of the conflict, then the journalist and or the humanitarian actor can be viewed as taking part in the conflict and can be targeted. For example, also when I was in the Eastern Democratic Republic of Congo, I remember being interviewed and having to be a little bit careful about what I was saying in terms of what I saw. For example, wounded people, people who had been wounded. If I talked completely openly about who was wounded, where they were wounded, what battles were going on, things like that, that's giving out a lot of information. And then the humanitarian actor could become a source or a target for one of the armed groups. Often with rapid onset emergencies, there's clearly a competition between organizations to be one of the first on the ground to be able to start serving the affected people. And during that phase, it's often quite chaotic, and oftentimes the best organizations do treat it in a professional manner. And they have absolutely no interest in exaggerating the numbers that they get, because later on it could come back to haunt them. If it's deemed to be incorrect, the initial information that they give out, then that will harm their reputation. So in general, they try to be fair and verify the sources. However, there have been circumstances where the numbers have been exaggerated. There's a very controversial study that was out concerning the Democratic Republic of Congo during what was called the African World War. And the numbers that were circulating at the time were around 6 million people who had died directly or indirectly as a cause of the conflict. Since then, various studies have shown that it's improbable that the numbers were that high. The aid agency still stands by its methodology to have in the calculation of that number, but a lot of experts are dubious. So even with numbers coming from aid groups and human rights groups, you need to check your sources. I think in a humanitarian emergency, the information that's produced needs to be useful to make decisions, both for humanitarian actors and for the people who have been affected directly by the crisis. And so those are two different populations in mind, but oftentimes it's information that's similar that will interest both those groups, both the aid agencies and local agencies, local authorities who are trying to bring help to the zone, and also the people who have to decide, do I need to rebuild my house? Do I need to move somewhere else? Is it safe here? How do I protect myself from epidemics? Where can I find food, safe water? Oftentimes, the same information is useful for both groups. Fondation Hirondelle, right now, we're thinking about how to make up a team that's going to be rapidly effective in rapid onset emergencies, to be able to give life-saving or life-preserving information out in the first days after the disaster strikes. It is absolutely possible to do this. It requires a lot of organization beforehand to make sure we have the right people who are competent and also the right technical solution. For example, having an independent transmitter that is powered by solar panel could be one of the solutions we could have. In places where there's not enough sun, obviously that wouldn't be the right solution. In other places, perhaps taking advantage of social media could be an option if the infrastructure has not been damaged and mobile phones, what have you, the internet is working. Right now in our thinking, it's absolutely possible to be able to deploy a team that is used to either violent situations or natural disasters that can rapidly assess what the state of infrastructure is, to be able to determine what kind of information is the most pertinent and also the best way to broadcast that information. It's a good question. It'd be interesting to at least test the notion that that people have a right to know or deserve to know what's happening or what happened to loved ones, family members, houses, villages when they have abandoned them because of forced displacement. That information is often very, very sensitive because with forced displacement, you're talking about armed groups, you're talking about governments, you're talking about high-level interests. And unfortunately, a lot of times, I think in those contexts, there's a tight control on what media can and can't do. And to be able to report honestly and truthfully on what really has happened to the village they abandoned in a context where the authorities don't necessarily want them to know, it can be difficult. I think as far as tracking lost and maybe dead family members, that is obviously something that will be a major preoccupation for the individuals concerned. I'm wondering though, it's such on an individual level. There are certain agencies that specialize in that, but to ask media to go into that level of detail for individual families may not be practical. It'd be interesting, and obviously it'd be an information extremely important for those affected, but for media to have that kind of means would be very difficult.